Once daily Vibegron 75 milligrams improves quality of life and incontinence efficacy endpoints in patients with overactive bladder. Double-blind 52-week results from an extension study of the EMPOWUR International Phase 3 trial. Disclosures. Vibegron is a highly selective beta-3 receptor agonist under investigation for the treatment of OAB. EMPOWUR was an international Phase 3 double-blind 12-week trial. 1,518 adults with wet or dry OAB were randomly assigned to receive once-daily Vibegron, placebo, or the active control tolterodine. Compared with placebo, Vibegron 75 milligrams significantly improved the co-primary endpoints of daily micturitions and urgency urinary incontinence episodes. Vibegron was numerically better than tolterodine in all evaluable efficacy measures and was well tolerated. Patients who received Vibegron or tolterodine in the 12-week EMPOWUR trial continued with the same treatment in the double-blind extension. Patients who received placebo in EMPOWUR were randomly assigned in the extension to receive Vibegron or tolterodine. The primary endpoint of the extension trial was the safety and tolerability of Vibegron. Efficacy endpoints included changes from EMPOWUR baseline at week 52 in average daily micturitions and in urgency urinary incontinence, urgency, and total urinary incontinence episodes. Here, we present exploratory efficacy endpoints, including quality of life measures, using the Overactive Bladder Questionnaire long form and responder analyses consisting of the percentage of patients with at least 75% and 100% reduction in urgency urinary incontinence episodes and percentage of patients with at least a 50% reduction in total incontinence episodes. 506 of the first 587 EMPOWUR completers elected to participate in the extension study. 505 received at least one dose of study medication and were included in the safety analysis. The overall completion rate for the extension trial was 85%, with similar completion rates across the treatment groups. The baseline characteristics for the extension trial were similar to EMPOWUR. The mean patient age was 61 years, 78% were women, and 78% had OAB wet. Adverse events were reported in approximately 63% of patients receiving Vibegron and 54% of patients receiving tolterodine. 4 patients who received Vibegron and 8 patients who received tolterodine discontinued study medication due to an adverse event. Incidence of adverse events were similar between groups. However, a greater percentage of patients who received tolterodine reported dry mouth. A UUI responder analysis showed that 61% of Vibegron treated patients had at least a 75% reduction in urge urinary incontinence episodes at week 52, and 41% of patients had a 100% reduction and became dry, meaning the patient reported no incontinence episodes on any day of the 7-day diary. A responder analysis for the total incontinence episodes endpoint showed that 71% of Vibegron treated patients had at least a 50% reduction in total incontinence episodes. Overall, a numerically greater percentage of patients treated with Vibegron achieved the pre-specified responder endpoints compared with tolterodine. At baseline, mean OAB-Q scores were similar between patients treated with Vibegron and tolterodine. Among patients receiving 52 weeks of active treatment, mean change from baseline in the Vibegron group was numerically better than in the tolterodine group for all OAB-Q subscales. Consistent with the placebo-controlled EMPOWUR Phase 3 trial, Vibegron had a favorable long-term safety profile in patients with OAB. Treatment with Vibegron was generally well tolerated. A numerically greater percentage of patients receiving Vibegron met clinically meaningful incontinence responder endpoints relative to tolterodine. 41% of Vibegron-treated patients had no urge incontinence episodes at week 52. Patients treated with Vibegron had numerically greater improvement in quality of life endpoints compared with tolterodine. Thank you.